After a century of progress on mortality rates for white non-Hispanics in the U.S. started to move in the wrong direction. And this put us at odds with other rich countries. It put us at odds with the other English-speaking countries where in middle age, mortality continues to fall at about 2% a year. And in America, that stopped happening.
When we're talking about health and health insurance, it's very important to make sure these people are protected. And I think when people are thinking about health reform, which there's a lot of discussion about health reform these days,
and to you fellow parents out there,
they should certainly look at our paper and realize what is happening to these people already and take that into account when they design new systems.
For every successive birth cohort, so people born, say, in 1960 relative to 1950 or 1980 relative to 1970, what we call deaths of despair, deaths from suicide, from drug overdose, from alcohol-related liver diseases, are on the upswing, and each successive birth cohort looks like they're at higher risk.
There really is a decline of the American working class, which reached its heyday with the blue-collar aristocrats of the early 1970s with good union jobs and a job you could get where you got on the promotion line and you got a promotion every year and you built a middle-class life for yourself and your family, and that gave a whole mode of existence, which was very important to people. And achieving that mode of existence has become harder and harder.
This paper for Brookings has already filled my email box this morning with letters from people who want to tell us their stories about people they've lost to suicide, people they've lost to drugs, or their own fears about growing old and not having enough resources. Mortality rates overall are rising in almost every state, New Jersey, New York, California being the only exceptions. So this is a problem in cities, it's a problem in suburbs, it's a problem in rural areas. And the people who are really getting hammered are people with less education. It's almost as if now there are two Americas, one for people who went to college and one for people who didn't. And it's the people who didn't go to college who are actually facing these larger mortality rates. The opioid crisis in America certainly is an accelerant to what's been going on.